Welcome to another episode of Smiles in the Air, your oral health and prevention podcast. I'm Celso da Costa, and today with me I have Neha and Marie-Christine. So, today it's a particular episode, right? Because we're going to talk about education. We have Neha on the Swiss Dental Academy, and we have also MC. I'm going to call her MC because I'm used to it, so it's easy for me, from the Swiss DolorClast Academy. So, first of all, what is the Swiss Dental Academy, Neha?
Swiss Dental Academy is an educational arm, I would say, of EMS. It is the absolute basis where we are imparting knowledge, I would say continuous education, to all clinicians across the globe that believe in prevention.
And what is the SDCA?
In a few words, actually, it's almost like what Nez said. It's a kind of a global community gathering shockwave practitioners where they share and learn knowledge and latest advance in the clinical field, and we are happy to cover this worldwide.
And that's the beauty. That's why we are talking here today, because we have the pain therapy at TMS, so we created the educational branch that is the SDCA, sorry, and we have also the dental part with GBT, and we needed the Swiss Dental Academy. Not only we have a third one that is the Swiss Urology Academy, but we didn't have the space for everyone, as you can see in terms of the seats. But the truth is that we are engaged with education, and we understood that the clinicians are a little bit more than just mere machines that are applying a protocol or that they are using a device, but they need to be also integrated and see the human being that is in front of it. So would you say that the education is the biggest parts that we are organizing today in terms of not only deliver a device but delivering a solution?
Absolutely, we're not talking products at all because, as you know, commercially as well, anywhere, from a personal standpoint as well, if you look at it from a patient perspective, you would not want to use anything unless you know what it is and how to use it correctly. Just an example of a phone, for example. So everything, I think it's very important that we talk about it from a point of scientifically proven, from the point of usability, from the point of correct recommendations on usage. So there are fine key points when we talk about overall education. So it's not just about theory. So it's not just about knowing about something just for the sake of it. It's really a detailed thing in order to really have clinicians across the globe understand the why, the how, etc. on usage.
Do you see the same thing relating with the pain therapy business?
I think with the SDCA, it's the same. We embrace a solution rather than a product, even if we provide the technical specifications of the products during the courses, and whether we provide all the tips and tricks. We always want to cover a global solution, which helps practitioners um, uh, improve their work in their daily practice, and also offer the best clinical treatment outcomes for their patients.
And what is the biggest change? Because, okay, I have a little bit more history about the SDA. Of course, we know that we built the SDA in 2006, and it was more oriented like how to use a device. Today is not
Correct.
really on that the same idea or vision. It changed, luckily. But do you feel also on the SDCA that the clinicians are also shifting for just tell me how to use it to more like why I'm using it?
Actually, at the beginning, when we launched the Swiss DolorClast method in the early 2000, it was more product related, And then when we started the training courses afterwards with the Swiss DolorClast Academy, 6 years later, uh, we tried to switch already from the product to the solution. And today it's clear that we are switching from a product point of view to a global solution. Yes.
And what was the role? Because I know, otherwise I wouldn't be here, that there's a huge investment in terms of scientific studies. What was the role of the scientific studies for development of the Swiss Dental Academy and also of the Swiss DolorClast Academy?
Should I go first? Okay. So coming from a dental standpoint, I would say that when SDA was established in 2006, as you said, we were focusing just on the device. From an EMS perspective, we did not want clinicians to believe that we are only selling devices and products. So it was important that they understand the science behind it, they understand the usability, they understand the ethical component. So everything that we are talking at the Swiss Dental Academy is backed by scientific evidence. So in terms of assuring the patient, in terms of assuring the clinician their own overall health, hygiene, I think we needed to have some scientific data.
How is going on the SDCA?
Well, I have to say it's almost the same actually when we started the trainings in 2000, in the early 2000. First it was with an association, and then we switched to the academy in 2012. It was the same because we propose we have approved indications when we treat with the products. And with each approved indication is backed up by a clinical study. So we never propose to treat something without having a clinical study behind. And that's the beauty of it, because it's safe, clinically proven, and also easy to use.
Well, the interesting thing also is that we have the big sister that is the Swiss Dental Academy. We have the middle sister that is the SDCA, and then we have today the younger sister that is the Swiss Urology Academy that has been 2 years that is around. SDA is today the biggest organization in terms of prophylaxis and non-surgical periodontal treatment education. And we have now with DolorClast, with guided DolorClast therapy, and with the academy that we are trying to reach the same standards or the same goals. How you see this cooperation? Because in previous episodes I got Daniel also here talking how he treat me. I got also Philip that also the same thing. I'm being lucky. I'm getting treated a lot by good physicians.
You should not be needing treatments.
Yeah, I always need treatments. You know, I think that I'm young still, so
That's exactly the reason why.
I push my body.
We can occasionally become patients.
Yeah, but the thing is, like, we see kind of a cooperation between the dental world and the pain management world, and we see the same thing maybe in the academies. How could we interlink it?
I think from an SD perspective, one of the things that we're focusing on is the ergonomics. So when the clinician is using the right posture, he should not have any musculoskeletal disorders. If they do, there we have the academy to really treat all of that. It's something that, of course, that should not, but we know that today with the traditional approach, I would say there is still a big chunk of clinicians following the traditional technologies and the methodologies. And they do have a lot of musculoskeletal disorders. So whether it's the neck, the wrist, the carpal tunnel syndrome.
Some of them, they are already old injuries. Now, even if we switch today for GBT, for example, we're always carrying the baggage from previous behaviors or habits. And we all have habits. I can tell you, like when I'm in the car, I'm always leaning on my left side because I like to drive with my left hand. So by doing this, I'm already predisposing myself to have some musculoskeletal disorder somehow. And that's where the SDA can get in, right? Because it's not just
Exactly.
the treatment itself, but it's the rehab.
The rehab is very important. Yeah, rehabilitation, exercising is part also of this global treatment solution. It's true that, and that's what Daniel mentioned last time. It's true that practitioners, clinicians can suffer from musculoskeletal disorders when treating their patients, and this is where the DolorClast and other treatment modalities can enter in. Yeah.
Yeah. But just to reassure every clinician that is listening to us, I got treated because, like, again, I thought that
Sports
there was
injury.
yes.
Yes, I know that. I'm just pulling your leg. No,
So
we can see you're very sporty. So
nah, nah. I wish to have to be a little bit more. We can see that you are being sporty, and you too. Like that.
A
That's
little
the
bit, yeah.
benefits of being part of the SDA and the SDCA is that we know what is good for us. So we try to
Exactly.
behave.
Exactly.
Yeah, and don't eat a lot of
we
sugar
try.
too.
And it's part also of good habits.
Good habits. Yeah.
Exactly.
What's next for the SDCA?
What's next? The next level.
Yeah,
The
because
next.
today we are providing. This year we will provide around 350 courses, right?
Right. Mhm.
So this is already a good step.
This is already a good step, and we also would like to offer more, let's say, online short sessions, providing maybe more testimonials on success stories, which are they are we have lots of success stories, but in my view, we don't hear much of these. We should hear more of these successful stories, and maybe that's the second step to emphasize and offer more of the stories on our socials, and also more e-learning maybe to our users.
We are
Offer
pushing
them
for the
some
micro learning this year for the SDCA.
exactly.
That's already the cooperation, like
Mm,
what was working in the SDA that we can also transpose for the
mhm.
SDCA.
And maybe for the urology side as well, we could.
Yeah, urology,
Maybe.
it's coming with 5 micro learning videos. Then we have
Mhm.
10 new for the SDCA and 10 new for the SDA this year. So that's also stay
Nice,
tuned for
nice
sure.
program.
All the information will be on social media. All the information will also be available on the websites. And yeah, it's bite-sized learning, right? Less than 4 minutes, and you can learn everything that you need to learn about the dollar class or even GBT. And what's next for GBT for the SDA?
Oh, I think the next would be really we're moving from group practices, anyways, to really private courses. So I think it's important that every clinician is exposed or at least understands the basic concepts. So we're trying to get into universities so at an early stage. We also have a lot of training centers across the world where you have access, every clinician has access to it. So I think slowly and steadily, of course, with social media, digitalization, I think that is going to play a very big role to create awareness.
Yeah. Last year was a record year again. 6,398 SDA courses live, presential courses, more than 45,000 clinicians. So it was a huge improvement, and that's where we are trying to get the SDCA today. The good thing, and for the listeners again, if you want to book a course, if you are a dental professional on the SDA, you can go to the Swiss Dental Academy online and you can book a course. And for the SDCA, we have also our educational pages on the DolorClast EMS page. So this is also process of the digitalization that we are making on the academies, right? Because everything is to a distance of a click today.
Absolutely.
Exactly.
So you told a little bit, both of you actually. You talk a little bit about social media and how the academies are getting into it, and how we are thinking about passing for the next level through education on social media. More examples. Why this? That's the first question. And the second one, give me examples.
I think number one is really trying to change your thinking. So when clinicians like me, who I've graduated long time ago,
Come on. So that
For us, yes, it's a fact. I mean, I would see something new on social media. The first thing is always fear of the unknown. And you do not want to change because you're comfortably doing, you have fantastic results. But through social media, we've seen the new generation really catching up, talking about their overall health, ergonomics, economics. So when you see a positive effect, you are tempted to change. You want to at least try. So I think the first step for me for social media is just learning. So this acceptability, I think we are giving a lot of old timers, a lot of experienced clinicians an opportunity through social media, to change, to have access globally. So
Mm-mm.
So it's more like that direction also with the SDCA, that you are trying to get more, not availability, but be more accessible to the
Yes,
clinicians.
more accessible towards our end users, and I would say also in terms of clinical trials. Well, today clinical studies tend to um, still promote the old, let's say, the old way of treatment using the old settings, not going beyond the scheme of 2000 shocks, stay with 8 hertz. But we can improve that, and we can offer a better treatment outcome if we treat at 20 hertz, for example, with by doubling also the number of shocks, 4,000, 6,000 shocks. Today, it's been proven that high energy, high number of shocks offers a better outcome for the patient. So
So to disrupt the traditional way of working, you are also trying to disrupt the way of how you are sharing this knowledge.
exactly,
So not
modernize a little bit.
modernize.
Yeah,
Yeah.
remove the dust.
Remove the dust. Maybe that's a good word. Yeah.
Remove the dust from the carpet.
Yeah. And I think that's what makes and builds a community, right? We
Mhm.
see from both sides, dollar class and GBT, that we have more and more these fans
Mhm.
or community that really are belonging to this disruptive movement, that they want to make something that will change the future. Both academies also training clinician in terms of go to the prevention when you are treating is too late. And I need to say this, but every 2 months I'm going to my physio and I'm having shockwave as a preventive measure.
Mhm.
So and it works quite
Yeah.
well.
Mhm.
I convert him. He was using another thing, and then now he changed for $class, so I was happy with it.
excellent.
And I think that's what we need to pass here. The message in terms of the education, it's not because we want to be more invasive and we want to
Mhm.
teach. We don't want to teach. We want to share experience actually and learn from the participants most of the times. And we want to work in terms of prevention. So we are in the health business, so let's be ethical and work with health and not with disease.
Absolutely.
Mhm.
I think from a patient perspective, this is really important. And that's another thing that we want to get to slowly and
Exactly.
steadily.
Slowly there. Yeah.
Yes.
Exactly. Promote health rather than disease. Yeah.
Yes.
This is what Hippocrates used to say as well.
Cool. So I'm being compared with Hippocrates without. Okay, that's I made my day, MC. So thank you. That was a good comment. Um, anything that you want to add? Because we talk about how we are disrupting the traditional market of the health business through the academy. We also said that education maybe is the strongest point that we have today at EMS. Otherwise, we wouldn't be investing on the Swiss Dental Academy or the Swiss DolorClast Academy, and now the Swiss Urology Academy. We also talk that we are modernizing, right? We can book a course on our website, but we can also, and we are trying to push the social media to have
Mhm.
this social media learning, in a way, and we are trying to build a community. And I couldn't be happier to have Neha and MC with us, helping building this community. So hope that in 2-3 years we were talking about the SDCA and saying that we have already 6,000 courses. I think that will be cool because
I would love to.
and I think the
I'm
potential
sure.
is there. The problem is that maybe we don't talk that much about the dollar class, so it's a nice opportunity to have this podcast here and have listeners talking about dollar class, because not only for people that are in pain, but clinicians that are out there that maybe they are suffering with some neck, back, elbow, wrist pain that we can solve. And
Exactly.
I was impressed. My foot, it got solved in 3 sessions when I spent 6 months without having any results. And then in 3 weeks, 1 session a week, everything's good.
Wow.
Yeah. It's amazing. It's an amazing treatment, I have to say.
Yeah.
I've had it as well.
Yeah.
One treatment.
So, Neha, MC, thank you so much.
Thank
It was
you
really a
for
pleasure
Thank you
to
very
have you
much.
here. For the listeners, let's get your GBT done so you have a nice smile, and then let's get your DolorClast, your shockwave treatment done so you don't have any pain at all. And do not forget, don't miss the next episodes of Smiles in the Air, your oral health and prevention podcast, and visit our Spotify or Apple Podcasts and also our YouTube channel, and you can have access to all the other episodes. So stay tuned. See you next time.